This is Plant-Based Briefing, Diet and Diabetes, Recipes for Success, Part 1 from Physicians Committee for Responsible Medicine at pcrm.org. And I'm Marian Erickson, and this is the Plant-Based Podcast where I curate, get permission, and narrate a variety of articles from experts in about 10 minutes or less every weekday. And today's article is a bit longer than that, so it's a two-parter. I'm reading Part 1 today, and Part 2 will be tomorrow. It's from the Physicians Committee for Responsible Medicine, a nonprofit organization founded by Dr. Neal Barnard, and they combine the clout and expertise of more than 17,000 physicians and 1 million members and supporters worldwide. They're changing the way doctors treat chronic diseases such as diabetes, heart disease, obesity, and cancer by putting prevention over pills and empowering patients to take control of their own health. And since 1985, they've worked tirelessly for alternatives to the use of animals in medical education and research, and for more effective scientific methods. So now let's get to today's plant-based briefing. Diet and Diabetes, Recipes for Success, Part 1 from Physicians Committee for Responsible Medicine at pcrm.org. Diabetes Basics. In the past few years, much of what we thought we knew about diabetes has been turned on its head. New understanding of the nutritional causes of diabetes gives us the power to keep it from occurring or to turn it around. Here's what is supposed to happen. Our bodies turn starchy and sugary foods into glucose for our muscle cells to use for fuel. Insulin, a hormone made in the pancreas, ushers glucose into the cells. People with type 2 diabetes, the most common type, generally have enough insulin. However, their cells become resistant to it, leaving too much glucose in the bloodstream where it can cause problems. Over the short run, people with uncontrolled diabetes may feel tired and thirsty, urinate frequently, and notice blurred vision. In the long run, they are at risk for heart disease, kidney problems, vision loss, nerve damage, and other difficulties. Dietary approaches to diabetes. Diabetes diets typically call for portion control, carbohydrate limits, and for those who are overweight, calorie restrictions. Fortunately, there's another way. Low-fat, plant-based diets are ideal for diabetes and the conditions associated with it, such as heart disease, weight gain, high cholesterol, and high blood pressure. And they offer the advantage of not requiring any weighing or measuring of portions. Going hungry is not necessary. The old approach recommended cutting down on carbohydrates. It's true that overly processed carbohydrates, those made with sugar or white flour, for example, are poor choices. However, delicious, unprocessed or minimally processed foods such as potatoes, rice, oats, beans, pasta, fruit, and vegetables were the main part of the diet in countries where people were traditionally fit and trim and where diabetes was rare. Unfortunately, highly processed carbohydrates and affordable meat and cheese dishes have moved in, and now we have a worldwide type 2 diabetes epidemic. A low-fat vegetarian approach recognizes that whole food carbohydrates are fine. It's the fat in our diets that's the problem. New information suggests that fat in animal products and oils interferes with insulin's ability to move glucose into the cells. Eating less fat reduces body fat. Less body fat allows insulin to do its job. However, choosing skinless chicken, skim milk, and baked fish is not enough of a change for most people to beat diabetes. This new approach eliminates fatty foods and animal protein, such as meats, dairy products, and oils, and offers unlimited grains, legumes, fruits, and vegetables. One study found that 21 of 23 patients on oral medications and 13 of 17 patients on insulin were able to get off their medications after 26 days on a near-vegetarian diet and exercise program. During 2- and 3-year follow-ups, most people with diabetes treated with this regimen have retained their gains. The dietary changes are simple but profound, and they work. A study conducted by the Physicians Committee for Responsible Medicine with the George Washington University and the University of Toronto looked at the health benefits of a low-fat, unrefined vegan diet excluding all animal products in people with type 2 diabetes. Portions of vegetables, grains, fruits, and legumes were unlimited. The vegan diet group was compared with a group following a portion-controlled, higher-fat diet based on American Diabetes Association, or ADA, guidelines. The results of this 22-week study were astounding. A total of 43% of the vegan group and 26% of the ADA group reduced their diabetes medications. Among those whose medications remained constant, the vegan group lowered hemoglobin A1C, an index of long-term blood glucose control, by 1.2 points, 3 times the change in the ADA group. The vegan group lost an average of about 13 pounds compared with about 9 pounds in the 88 group, and among those participants who didn't change their lipid-lowering medications, the vegan group also had more substantial decreases in their total and LDL cholesterol levels compared with the 88 group. This study illustrates that a plant-based diet can dramatically improve the health of people with diabetes. It also shows that people found this way of eating highly acceptable and easy to follow. Both the American and Canadian Diabetes Associations include plant-based as a diet option, and the American Association of Clinical Endocrinologists and the American College of Endocrinology recommend a plant-based meal plan for people with type 2 diabetes. Type 1 diabetes and diet. Diet can help to reduce the amount of insulin needed and reduce the risk of complications in people with type 1 diabetes, a condition in which the body stops making insulin and frequent injections or an insulin pump is required. For more information, visit pcrm.org/type1diabetes. Some research suggests that cow's milk may increase the risk of developing type 1 diabetes. For this reason, among others, the American Academy of Pediatrics recommends the avoidance of cow's milk during the first year of life. Breastfeeding mothers may do well to avoid cow's milk until more research is completed. You just listened to Diet and Diabetes, Recipes for Success, Part 1 from Physicians Committee for Responsible Medicine at pcrm.org. And I'm your host, Marian Erickson. Physicians Committee is running an online diabetes reversal program and study starting this Thursday, September 21st, running through December 14th. I'll link information in the show notes, but you can also go to pcrm.org and search diabetes, and you'll find that as well. And tune in tomorrow for part 2 of this episode, where you'll hear about the remarkably simple new dietary approach to diabetes and meal suggestions to prevent and reverse type 2 diabetes. So please share this episode with anyone who might benefit, and thanks for listening.